Hello, my name is Sammy Wakefield, and I'm an occupational therapist and the inventor of HAMI. I'm going to show you some important posture principles that HAMI can teach. In order to understand the importance of HAMI lessons, I begin with this saying: what happens at the lips and the fingertips begins at the hips. The pelvis, its position and movements ripple up the spine and have profound effects on how the shoulders sit on the rib cage, how the head sits on the neck, and how much the eyes can see. In order to use arms, hands, and vision effectively to coordinate the jaw, chest, and throat to chew, swallow, and breathe, there must be a good basic support for all these structures. And this support begins at the pelvis. Now, you look at HAMI and you see HAMI has no rib cage and no arms. That's on purpose because I don't want you to be distracted visually from the importance of what HAMI can demonstrate. And that is the fact that the pelvis is greatly affected by the muscle groups that attach it to the legs. HAMI does have a head and a line indicating the direction of his vision. Moving the head into a position where the eyes can see straight and to the side is called head righting. It's a powerful protective reaction to gravity, and it will happen even if good posture has to be sacrificed. HAMI is a model created with simplified anatomy that's not meant to be exact anatomy, but to show some specific and important movement features. People with mobility impairments spend a lot of time in the seated position out of necessity. Both the hamstrings and the hip flexors can lose some of their range of motion because of this. Both of these are multi-joint muscles. What happens at one joint is going to affect the motion of the other joint because they're connected. And tightness in either the hamstrings or the hip flexors can play havoc with pelvic positions and thus affect everything attached to the spine. It's imperative to understand these influences in order to achieve the most functional postures and to prevent needless body shape distortions in both the sitting and the lying positions. Let us begin talking about the hamstrings. The hamstring muscles go over the back of the hip joint and the back of the knee joint. To begin this demonstration, I begin with a neutral position with the cord locks released to the ends of the cord. The right leg is set up for only the hamstring, and the left leg is set up for only the hip flexors. So as I demonstrate one leg, I'll let the other one follow along in the same position. The pelvis is in a little anterior tilt with no rotation or sideways tilt. Rotation. The spine has a gentle low back curve and upper back curve, and the head is in a righted position with the eyes looking straight ahead, the eye line parallel to the floor. When I tighten the hamstring on the right leg, we can see that moving the knee into extension also causes the hip to straighten out. This causes the pelvis to tilt backwards and slide forward on the seat surface. Gravity triggers a righting reaction that pulls the head, neck, and spine forward into a rounded position. The neck then bends backward to allow the eyes to look straight ahead instead of down. HAMI can now see where he's going, but there are consequences to this posture. There are poor breathing and poor swallowing with more risk of choking. This sliding forward on the seat and the pressure on the pointy tailbone is risky for the skin. Both of these effects on life and death functions are a high price to pay for not accommodating tight hamstrings. The position of the shoulders, of the arms, and the hands are also compromised for good function as well. The seated position is a position of function, poorly suited mechanically for attempting to stretch tight hamstrings. Accommodation for tight hamstrings and giving priority to a well-aligned upper body posture and a position of function is best practice for the seated position. Now let's talk about Hammy's hip flexors on his left leg. The hip flexors we're talking about are those that bend both the hip joint and straighten the knee. People with low muscle tone or with weakness in the trunk and hips often have an unstable pelvis and tilt it forward into anterior tilt to balance in the seated position. As part of the balancing forward, a sway back develops to allow righting of the head. People often use this posture to help with arm position, for hand function, and sometimes to prop for support. Over time, gravity and increased weakness will tilt the pelvis farther forward and the back will sway more and get stuck in that position. Because some hip flexors also cross the knees, some people with trunk weakness will also prefer to sit with their knees extended, causing additional hip flexor tightness. Lowering, elevating leg rest can then cause more forward tilting of the pelvis, a greater sway back, and increased spine extension as the righting reaction is triggered. These positions can compromise breathing, swallowing, and digestion, consequences that affect life and death functions. Again, a high price to pay for not recognizing and addressing poor pelvic stability and the resulting tight hip flexors. If the pelvis is stabilized in a slightly posterior position before becoming habituated in anterior tilt, these posture problems are more likely to be delayed or avoided. In the seated position, Hammy has shown us the importance of giving priority to stable posture alignment in support of function and health. But what about doing something to improve the range of motion of the tight hamstrings or hip flexors? And what about the lying position? And is it possible to make gravity a friend instead of a destructive force? These questions and others will be addressed in the second video. You'll be able to find it on the Hammy page.